Are we live streaming yet there, sir?
Yeah.
Okay. Let's get a roll call. Who is not here? I know Mike Didio is not here. He's got some family issues. So Elaine's here, Andy's here, Trish is here, Heidi's here, Chris is here, and I'm here. Okay. I'd like to call our first JPS safety committee meeting to order, and let's look at minutes to approve.
Second.
All in favor?
Aye.
Any opposed? Okay. Appointments, says none. Denise January, you are up first.
Good evening, good evening. Happy New Year. Just a few things on my report that I would like to highlight. I did send an updated report today, so hopefully you guys got that. In regards to staffing, COVID is finally taking a toll on us. Seems to be like a vicious cycle of 2 out at all times. Today at 7:30 this morning, we finally had everyone back, with the exception of one out on a long-term medical leave. We did have, and I do highlight this for a reason, but we did have 3 employees last year who had perfect attendance. Might seem like a silly thing to highlight, but in the 911 center, it's huge. They get burned out and need mental health days. So I do have 3 people who made it through a tough year last year with perfect attendance. They were Denise Cornelius, Hayden Longest, and Petty Angie. Another thing I'd like to highlight, because I haven't talked about it since it's been put in place, is our database analyst. Wow, what a lifesaver. That position, I know I begged, stealed, and borrowed for that position for years, and that has been a huge, huge help. We're so much more successful with discovery. We're keeping up on those requests. He's actually heading to his first trial next week. So with regards to the GIS duties, having somebody in-house, we didn't realize, I think, how much benefit that would be until we had it. It's just been fantastic.
I'm sorry, that's how the 911 and the geolocators work.
He does all of our addressing. Yep.
Gotcha.
Yep. So, and he's extremely proactive, forward thinking. He's really been a godsend. Just to kind of go over 2021, our calls for service, you can see we're up about 16%. And our 911 calls are up about 16%, and our calls for service, which a call for service is, that means something was generated in CAD, which is our computer aided dispatch system. It means a traffic stop, it means a sick person, it means a cardiac. Our fire and EMS calls have definitely escalated, and I associate some of that with COVID. In regards to taking over Auburn City Ambulance, definitely become a challenge. It's a lot more work than we expected. I think we knew that it was going to be some added work, but you can see here they've done over 1,400 calls in the last 2 months. That's a lot. They're busy. They're extremely busy. So for those of you who were here last year, you heard me talk about the need for more positions. You're going to hear it this year because we really need it. We've really got to split up our fire dispatchers. They're overwhelmed on a daily basis. In regards to salary, this is kind of something I did talk a little bit about last year. When I say there's a kind of a balance, if you look at what we spend on salaries, what we budget for annually on salaries and overtime, and what at the end of the year, what we call our savings, we could really absorb a couple positions. You would lose that savings, of course, but we could offset with a couple more positions that would really help our staff up. So I'm going to put together some more information as the months go on to provide, to kind of talk about that, because I'm not super anxious to get those positions right now. There's a test next Saturday. So we have 2 vacancies right now. that we need to fill. We don't have anybody on an active list to fill those with. We do need to wait for this new list. The test being held next Saturday, which means we won't have a list till probably mid-April. State Civil Service is not real speedy with that. So I don't expect that we would even hire until probably close to July, by the time we do some interviewing and background checks. It's a pretty thorough process, so I would expect to be mid-June, July before we would want to hire.
Just so, because I know I was there for all the
Yeah.
discussion last year, the 2 vacancies you currently have
Yeah.
are in your budget and budget.
They are,
So you'll have those first 6 months where you don't have expended any of that
That's
budget
correct.
line.
Yeah.
Even if you get to the mid-year and you say, fill these 2 budgeted vacancies and give me 1 additional staff.
Yep.
It could be all calculated and come out of contingency. That's like all the kind of stuff we talked about last year
and I would take a safe bet that I don't think we would even need to ask for contingency.
for 22.
Not for this year. I really don't think we would.
Because you have the budget
Yeah.
savings already of
Yep.
these 2 ones you can't fill till at least July.
Yeah, I think we'll have that savings.
Andy's got it.
Just also, last night we went through a lot of this. So with Chris, with the government ops, we're gonna start discussing this kind of idiocy of
Mhm.
doing all this, coming to
The ledge.
the ledge for stuff that's already budgeted.
Permission
So-
fills, you mean?
Yes, I mean, it's one thing for new, that makes
Right.
sense, but for this, something that's in your budget, you lose somebody, we had too long of a discussion about this last night, so.
Right, yeah.
We threw it to Petrus of government ops to figure it out, because it's asinine in plain English, if it's in your budget, you lose somebody, retirement, quit, death, whatever, I mean, to have to come and, beg for 3 months, basically, to get the
Right.
position filled.
The other thing, I feel like I'm reading you my whole report, but in regards to the emergency communication system, we are working with the Southern Chiefs. There's been some concerns about their coverage. We've done a lot of testing, and really what we found is the coverage hasn't degraded since we put the system in place. I think frustrations are just escalating. They're frustrated with areas that don't have good coverage. There are areas that have poor cell phone coverage, poor pager coverage, poor portable coverage. So we're looking at some avenues, obviously least cost invasive ways to solve some of those areas. They're small, they're spotty, it's a challenge. So we're working with our Motorola reps on ways to potentially resolve some of those. The moral is you're always gonna have bad spots. It's a matter of how many in an area are acceptable. So that's something that we're working through. One other thing that I just put on there today is there are 2 new grants that have just surfaced. Our SEEK grant and our PSAP grant. That could potentially bring in over $1 million. If we are successful with those. The deadlines are mid-February, I think. I have those ready to send out their process. I just want to do a final review on them. Generally what I do is I get them completed, wait a couple days, kind of get another look at them just to make sure we're not missing anything. And then submit those.
These are new duties.
These are new. We put a little bit in the budget. I think we put maybe 300,000 in the budget. So it definitely would be money that's not already in the budget. It'd be a good amount. And I'll give exact amounts once we know if we get the awards. I would anticipate these are due February, so I would expect that we'll hear maybe May, June timeframe, what the awards are. And then once I have that information, I'll look at what we budgeted and you'll be able to see what additional revenue we have.
Nice.
Yeah.
What would be the purpose for those funds? Is it for equipment or?
Yeah, so generally the SEEK grant, which is our statewide NRF grant, that pays for the Motorola maintenance, which is about $412,000 a year. It offsets the core maintenance, which is around $50,000. Pays for the microwave maintenance, which is another roughly $45,000. We generally do some kind of an upgrade, whether it be a microwave upgrade, governance, things that the grant requires, just to keep maintaining our system. we usually only have a couple $100,000 left for the upgrades after all the maintenance is paid for, because I generally take care of that first. Just because those are operational and those impact our budget. So anything I can offset, I try to do that first. And the PSAP grant, that's a smaller grant. That's usually between 165 and 180,000. And we use that generally for salaries.
You've gotten them a number of years, you just didn't budget for all of the.
Correct, because with the last couple of years with COVID, they've been spotty. So, we just didn't want to budget something that we just, there was so much unknown.
Anybody else got anything for Ms. Bingham? Okay, thank you very
Thank
much.
you.
Next up is Lloyd Hoskins, assigned counsel. Lloyd?
Thank you, Mr. Chairman. I'm gonna come up here, so you don't have your bags for me. Thank you. The committee hopefully had an opportunity to read my December report for the assigned council program. Just a couple other things I'd like to add. You will get a comprehensive year-end report on the activities of the assigned council program. Right now, it looks like we made assignments, a little over 1,500 assignments to family court, county court, Auburn City Court, justice courts, parole appeals, because we have 2 prisons in this county, as well as appellate division, assigning attorneys to the appellate division. A little over 1,556 cases that we assigned legal counsel to. Currently, we have 32 attorneys that work for the office. In addition to this, we have attorneys sit in Auburn City Court, felony drug court, misdemeanor court, behavioral health court, and domestic violence court. We are just starting now Auburn Intervention Court, in which an attorney will be in Auburn City Court on Monday, Tuesdays, and Fridays. So we're pretty busy. In addition to that, we are assigning attorneys at 7 a.m. and 7 p.m. at the centralized arraignment at the Public Safety Building. Real quick, the year-end numbers that came back for the CAP program, I thought were interesting with bail reform and I just get it here. The year-end report, we had 745 arraignments at the jail. With bail reform and all you hear about catch and release, as Chris at the DA office has said, 449, 62% of those were released. Only 38 of them were held for court at a later date. So I think that sends a strong message. Of those arraignments, 55% were for Auburn City Court, and 44% were for justice courts. So over half come from just the city of Auburn. The other half is from the county as a whole. But most importantly, I thought that statistic of 62% being released, 38% being held on bail was very evident. Questions, concerns? If not, I just have one resolution.
I have a question.
Oh, I'm sorry.
Oh, okay.
Trish, I didn't see, I'm sorry. Go ahead.
Thanks Lloyd for those numbers. And I guess I just was curious, do you know of the 62% that were released? How many have gone on to re-offend?
31%. I can tell you at least that. Because 31%, I don't mean to jump on your parade here, but it says there were 31% or 20 bench warrants were issued. So therefore, at least 31% went on to further delinquent behavior. At least,
Ooh, politically
of
correct.
that 62%.
And I'm not sure, because we haven't tracked that, Trish.
Okay.
I don't think,
Ms. Daly?
I think I've asked the sheriff this before, and I'm sure he gave me a very good answer that I didn't fully understand, but there's so many people that are released and not put into jail. We still have such a huge unsentenced population in jail, right? That's not from this, it's from some other reason?
It just has to do with the type of crimes that are being committed out there and allow the judge to put them in on bail. So we've got a lot of people being released over and over, but we've also got a number of people in our community that are committing crimes that bail can be set on.
And they haven't gone to court, that's what makes them unsentenced.
Right.
83 of them,
Actually, today we got 84 unsentenced inmates and 29 sentenced.
right?
We're looking at cases that
Wow, seems crazy.
are 9, 10 months old, that they're still sitting in jail.
I mean,
because-
they've been to court, obviously, if they're in jail, they haven't been sentenced.
Right, right.
So unless you have somebody plead guilty or be convicted in a trial, they're not gonna be sentenced. So when cases don't resolve with guilty pleas,
Then you go through the grand jury, the jury trial, all of that,
Sure.
that takes time. That's-
motions, hearings, yeah, so it gets, I mean, in the best circumstances, it's 6 months from the night of the trial. We're not under that situation right now, so that's why these cases.
So unless someone makes a deal, pleads guilty, does that, it's just gonna take its course
Sure, until
Yes.
the trial.
Till they get time served.
until they get. Okay, thanks.
Any other questions for Lloyd? Lloyd, if you want to go ahead and we'll go ahead and catch your.
Mr. Chairman, I just have one resolution. That's to reappoint, my appointment has expired, and this is to continue my appointment as assigned council director as part-time. The only change is that the existing budget, I'm in there at $16,000, $16,058 as part-time to run the assigned council program. And we
Sorry, say that again.
$16,058 a year to run the assigned council program. This resolution sets forth the hourly rate of $45 an hour. So we're going from a annual salary to an hourly salary because it's part-time.
So, and there's a,
He has been Hammett first. Go ahead, Andy.
So it's part-time, you can't surpass 17.
17 a quarter.
Correct.
Yeah,
17
so,
hours, right?
yeah, but I mean, total dollar amount, I think is like 17,000, 17,500, something like that.
But my intent though is we need, the St. Council office has to have, and we've budgeted, we're working on a $3.81 million grant from the state of New York, which includes money to pay for everything with the assigned council office. So we're looking in the next, I probably won't have it ready for next month, but probably in March, a supervising attorney and possibly a data officer to take the place of what work I won't be able to get done part-time.
Mr. Peters.
so if the resolution, the numbers are intact, what I'll do to expedite the process is, if it's comfortable and everybody's comfortable with the numbers that are in there, I'll move that for discussion and for ultimate.
We have a motion and a second. All in favor for discussion?
Just
Just
So going part-time for you, Lloyd, focusing all of the part-time work on assigned counsel. Means that we, as a county, we need to pick up and be responsible for youth bureau
And stop DWI
and stop DWI.
effective June 22nd. Or excuse me, January 22nd.
Okay.
You're essentially retiring from those positions. Oh, you're retiring and then coming back part-time.
Correct. I'm retiring on the 22nd with the hope to be reappointed on the 25th.
That'll have to be a vote of this body, correct?
Correct.
His wife doesn't want him home all the time.
I guess you and I were talking about, this works out, there still needs to be work completed in that office that you did full-time, and that's why your plan is to work through the civil service system, and you'll stay part-time,
Mhm.
hourly rate, up to 17.25 hours. And your plan would be to bring on a fully funded supervising attorney who sees cases and supervises the staff, is that?
Correct. Correct.
And
Doing
that-
essentially writing the grants, working with the legislature.
That would be a direct employee of the county.
Correct.
Which, isn't that technically how it was always supposed to be, so to speak?
Having an attorney in that position, you mean?
Yeah.
Yeah,
Yes.
and you found a way to fund this through,
Correct. We've included that in our, the state of New York was sued under the Harrell Herring Act, and they set aside X amount of monies for each county, and our amount for Cayuga County is 3.81 million. So that's included to be an expense as my current salary and my deputy administrator, and all the costs associated with the St. Council office have been covered by most of this grant.
just lastly, the hiring of this attorney will not make us a public defender's office. We're still staying as an assigned counsel operation with an attorney hired part-time new and the part-time something else.
That's my plan. If you go to a public defender's office,
Oh, no, I'm just saying that.
That's up to you.
Yeah, I think so really, we got two different issues going on here, right? So we have retiring and reappointing you. Then we have how we address the issues of the other duties, which you will no longer be doing as of January 22nd. Right?
Correct. But I'll certainly help the legislature with that transition.
Yeah, that's kind of what you're driving at.
In there and in the youth bureau. both
Right,
have to be
right,
looked
right.
at. Yep.
Only concern I have is why wouldn't you just?
I think you can be adjusted.
I know his wife.
Any-
She was my guidance counselor in school.
I'm not going there.
Yeah, I saw her a lot, yeah. So basically, I mean, I hate saying this out loud, but basically, we're going to get to where we legally should be anyhow,
Right. This is
with your retiring.
correct. This is a good breakoff point for Youth Bureau, Stop DWI, and then for the assigned counsel program to get it up to where it needs to be in terms
According to the
of
state,
standards.
yeah, so we have to do it anyhow, and so now we're gonna be doing it accordingly. to the
Perfect
state.
timing, I think.
My last question is, what's the significance of the 1 year? I mean, that's just what you're willing to commit, or is it gotta be appointed? Or-
It's a yearly appointment.
It is a year.
Yes.
It's the assigned counsel
Right.
administrator is a yearly appointment.
Yes.
Okay.
Chairman?
Yes. Is Tracy still gonna be working at a stop DWI?
For now, but once the legislature decides where that program would go, I guess it would be up to. So, yes, she is still working.
And that's, your retirement won't affect her.
Well, it needs to go under some department. The Stop DWI program.
So is that another discussion and another resolution time?
Right, and Brian and I have started that discussion.
Okay, I think,
There could be a transfer of function to a different department,
Absolutely.
if that's how that's to be handled.
Mr. Peters? Comment?
I guess I'm just, before we vote on this and get you squared away, my last concern would be whom is gonna determine how, like, for example, who chooses the supervising attorney? And the way that we choose to move forward as a county? Are you gonna come back to this committee?
Create and fill, correct.
Very
Yes.
good, thank you.
Did you have a question?
Yeah, I was just wondering, what is the total size of that stop DWI program, like budget wise approximately?
Yearly annual budget,
Yeah,
it's about 100 and I think this year's, we reduced it because the fine money hasn't been coming in like it should, so it's like 130, 135,
okay.
135,000.
And is it wholly funded through fines?
It's entirely funded by DWI fines,
Okay,
no
Yeah.
local share,
one staff person, when you leave?
part-time.
One part-time staff person? Okay.
So the 430 gets spent somewhere else, not
Well,
on salaries, right? I mean,
we give 35,000 goes to the DA's office to help the cost of an ADA. 30-some thousand goes to the sheriff's department, 30-some thousand goes to Auburn Police for their efforts in DWI enforcement. Another 20,000 goes into community advertising, billboards, radio ads, prevention of DWI. Very little goes into administrative costs.
Gotcha.
Any other questions or comments to Mr. Hodgson? I believe we have a motion and a second. All in favor?
Yeah.
Opposed? Carried. Thank you, sir. Let's see, who's up next? Mr. Duckett, Dr. Adam Duckett is up next. He has no updates. Is he on the computer? No. Okay, moving on. It would be just DA, but Brittany Antonacci is not with us today, but her deputy Chris Valdina is. Chris, you're up, buddy.
Thank you, Mr. Trunk. I'm mainly here because we have the two resolutions for the unfilled positions. Just briefly, we're very busy, both in terms of the backlog of trials. We have trials scheduled almost every other week for the next several months. Obviously, some of those were, I think, resolved with guilty pleas, but not all of them. I personally have 3 trials scheduled for March 21st. Obviously, only one is going to go, but that shows what a backlog there is in the court system. I don't have any numbers, but I know we have a lot of serious crimes going on. We have bank robbery in the West End today, the Key Bank. We have an armed robbery pending for that smoke shop by Tinkers there. We've had a lot of crimes involving illegal guns. So a lot of serious crimes going out there. We're currently down 3 prosecutors. We already had the resolution to fill the 1 position. We're here tonight on the resolutions to fill the other entry level 88 position, as well as the deputy chief assistant position, which we're hoping will let us get a more experienced felony level prosecutor in there, which we really need. Again, those are positions kind of like the discussion before, already in our budget, just the authorization to fill the deputy chief assistant position was vacated when Brittany became acting DA, and the 88 position was vacated when the person left for a new job. So we're just looking to get those filled, and I'm here to answer any other questions you may have.
Mr. Peters, I believe has a question.
Actually, if I could, Mr. Chair, for the sake of discussion, I'd like to move JP 2 and 3, if that's for discussion.
I'll second it.
Second.
Got a motion and a second. Any discussion about these two? Resolutions, and you want to do them as a bundle, correct?
Yes, please, if everybody's good with that.
Andy?
So these are already in the budget, right, Chris?
Yes.
My only question, because I'm unclear, if you do get the candidates to fill these, you'll then be at full staff, or you still have a vacancy?
No, we'll still have a vacancy because there's still a position that the other vacant position that's already, we already have authorization to fill.
Oh, so
Assuming
you're
we-
still working your way through filling that one. So
Yes.
there's 2 ADA entries and this.
Yes,
And if you can fill the 2 ADA entries and the deputy chief, you'll be,
at full staff.
okay.
Mr. Shea, I believe, has his hand up, and then Heidi.
Chris, any promising candidates? I know last time Brittany was here, it was lean.
Yeah, we've had some interviews. I think we've got some good leads. We don't have anything finalized yet.
Because she was gonna go on Indeed, I remember that. They were gonna try to do
Yeah,
something different.
yeah.
to-
We've definitely got it out there. We're looking very aggressively.
Bob and I have the same question.
Same questions.
Just quick one. So basically, these will probably be a little easier to fill, is what you're, like entry level is probably gonna be.
The entry level, you've got a greater population of people you can choose from. Obviously, they've got to be an attorney, they've got to be somebody willing to move here in an adjoining county, they've got, if they're not here already, they've got to be a suitable candidate. In this environment, a lot of people, it's tougher to find prosecutors nowadays than it was 23 years ago when I started. But I'm pretty confident that we will be able to find people. It's gonna take us the time to do that.
I saw in her report that there's a support person that has now left and the salary been reset. So I appreciate the fact was going to go right to HR and start to ask questions about looking at the grade and the salary and start there.
Yeah, she's working on that.
That's
yeah,
good.
with the support staff position.
Any other questions or comments on JP2 or JP3? All in favor?
Aye.
Opposed? Approved. Thank
Thanks.
you, Mr. Valdina. Let's see. Dale Courier, Spire EMO. Dale, are you on the internet?
I am. Good evening, everyone. Can you hear me?
Yep.
Okay. Welcome to all the new members. I look forward to meeting you in person at some point. I do have a couple of adjustments or changes to our report and some additional information. The first is I've been getting some emails regarding the distribution of the KN95 masks that we received from the state, as well as the COVID test kits. And I know some of you have been, or some legislators have been contacted by other agencies about getting some of these supplies. So I'll share all this information up front. All of the masks, all 32,000 were delivered to the town offices. The amount sent to each town was based on the population in that town, based on the 2020 census. So if you have people contact you for masks, please ask them to contact their town office. We don't have any. It's up to the towns to make those distributions as they see fit. All of the COVID test kits were given to the Community Action Program. As you may be aware, they did some drive-through distributions. They also had some other local distributions at Booker T. Washington and a number of other locations. And to my understanding, they have given out all the kits. But if they have any left, we're not aware of it. So please feel free to call them or have people call them. And I did a follow-up call to the state today. And at this point in time, there's no plan or expectation for any more kits or masks coming to us from the state. As far as changes in our report, I would like to highlight under the highest priority item, item B, on the 19th of this month, in conjunction with State Homeland Security Office of Emergency Management will be doing a 3-hour Tier 3 emergency management. It's an overview, fundamentals, if you will, specifically for appointed and elected officials. The idea here is to provide specific information on the state laws, other federal laws, et cetera, that dictate how emergencies and post-emergency recovery is handled. And it's 3 very valuable hours. My experience is folks who attend it find that they spend a lot less time later on or during an emergency in their neighborhood or their elected area, trying to sort through how things should be handled. In a nutshell, according to state law, all emergencies and disasters start and end locally and are the primary responsibility legally of the chief elected official. And often that message doesn't get out. So we wanted to hold this training session now that we have new elected officials and appointed officials, not only at the county level, but all the municipalities. So I hope you'll join us on the 19th at Cayuga Community College. If you can, please contact Rusty. You should have all received an invitation via email, but if you didn't, call Rusty at our office. He'll get you registered. Along with that, down in the planning section, we did, since I put this out here from FEMA, they're starting to move forward to look at getting the requisite documentation for the public assistance monies. I believe we're going to be chatting with them tomorrow on some of them. The county will be getting some money back for the highway department, and Union Springs has a very large claim in for damage. And we did find out today that there's now a notice of funding opportunity for $313 million for hazard mitigation planning projects, as well as additional planning. So we'll be reaching out to the communities. The applications are due April 1st. And a lot of the things we worked on in the last year to get the updated hazard mitigation plan written and approved may now be eligible for funding. So we'll keep you posted on that. And down at the bottom on the EMT refresher, when this was put out last week, we had 16 enrolled. When the course started Saturday, we were down to 10 for a variety of reasons. So it's fewer than we had anticipated. 16 is kind of our break-even point financially for state funding, if that's available. So we will be needing to commit some money to continue this class, but we do have that in the budget from previous classes. So that's all I have. I'd be glad to add or clarify on anything I've talked about.
Anybody have any questions for Mr. Courier? Comments? Mr. Basile?
Yes. This is Jim Basile.
Hi, Jim. How are you?
Good. Did I hear you say that they were distributed today to the towns, the masks?
No, they were distributed last week, mostly last week, or maybe on Monday to the towns. I believe Sterling got theirs on Monday because they were not available on Friday.
So if you're a village within a town, you have to contact the town. I would have to have the mayor for the village of Fairhaven contact the supervisor for the town of Sterling.
That's correct. Yes.
On the list at the villages listed. Okay, thank you.
Any other questions? Ms. Kerr, go ahead, please.
Thanks. Hi Dale, this is Trish Kerr.
Hi, Trish.
Hi. I was just wondering that, NOFA you mentioned for the hazard mitigation, is that for implementation projects or is that for planning?
Both. I believe 22 million is allocated for planning and 313 minus 22, 277 maybe, is for projects. So for example, if a local community put in, and I'll add a footnote here if I may, when communities took part in the updated hazard mitigation plan last year for the county and their community, they had to submit for their town at least 2 hazard mitigation projects. Many of them included, for example, putting in backup power generation for critical infrastructure or town offices, fire departments, those types of places. Those types of projects are eligible, as are buying property so that you can, clear out the houses so you don't have flooded homes in the future. There's a list of about 20 items that are eligible under the various projects. And that just came through at about noon today. So we expect we'll see more detailed information on those areas.
Okay, thank you.
Any other questions or comments from Mr. Courier? Dale does not have any resolutions. Thank you, Dale.
Thank you.
Next up is Jay, and I'm going to murder his name, Steve Westbelair.
Very good, sir. Thank you. Good try. Yes, good evening, everybody, and welcome to the new legislators. I look forward to working with everyone this year. No resolutions on for probation. I did provide a report that I intended to serve 2 purposes. In part, it's kind of a year-end review for 2021, but I also intended it as an overview of the department for new legislators. One point to add to this report is just this afternoon, one of the senior staff did come into my office and advised me that they are intending to retire within the next month and a half to 2 months. I do believe one other staff will announce their retirement probably by the time we get to the 4th of July. The department has been on the verge of a generational shift for some time. We're kind of an old bunch over there. We only have 3 probation officers under 40 at this point in time. So we're pretty top heavy with very senior people, a lot of experience, and it will definitely be a loss when that experience starts to transition, but I think that transition probably started today. As far as some other issues facing the department, future resolutions, we will be looking at a resolution and contract for a web search engine, which would help us track absconders and also help us satisfy part of our mission to pay restitution to victims. That's probably a month or so out, but you could add that to the body of the report as well. And I'd be happy to answer any questions.
Anybody have any questions for Jay?
How are you doing on your space issue in terms of that site that parole actually was in that they're not in?
I have not received any update at this point. The parole is not using that space. I don't know if they intend to come back. As far as I understand, there is no lease for them to return. I think I'm waiting for something from Buildings and Grounds to advise me whether or not
that space is available for us. We do need it. We are maxed out in our current location, and as I pointed out in my report, there are many aspects of modern probation that we're really not completely eligible or able to fulfill. Our offices are sufficient for what we're doing right now, but for any other duties, any changes in the future, increases of staff size or changes in programming, we couldn't make it work in our current location.
Yes. Who would be the contact to? Someone from the state, someone from the county? I mean, I don't.
Are you talking about the pros?
Yes, the
spot?
pro space has been empty for months and he's crammed.
So, you know, like I have to be really careful.
Uh-huh.
I think I think it's safe to say that we're in talks with, between Department of Community Supervision
And the county?
like the chairman and the chair of this committee will try to work out a spot for Department of Corrections Community Supervision.
If they want to return there or they don't. or-
They need the spot,
Oh,
but again,
okay.
I can't be part of that.
Do you know anything about?
No, just that Doug Roll needs a spot. I was just told
Okay.
today. we're gonna
Okay.
start working.
Basically, the same, I got kind of noticed today that, you know, we need to look for a spot, and, you know.
Whether
myself
it's
as the
that
chair-
spot or something else?
Yes,
Yeah,
obviously,
okay.
we gotta find a suitable position or place to put these folks so that they can do their interviews and whatnot. That fair to say, Jay?
Yeah, I believe that's correct. You know, when parole uses that space, we have an excellent relationship with them, and it's mutually beneficial for both departments. Unfortunately, I have to advocate for my department, and we're out of space. I mean, I understand parole would like it, but we could really use it as well. But ultimately, those decisions are yours, and I will abide by whatever that may be.
It's been vacant for months and months, you said, correct?
Yes, they've not taken reports there during the entire period of COVID.
Oh,
Any other questions for Jay? Comments? Thank you, Jay.
Yes, sir. Thank you very much.
Next up will be the sheriff, Mr. Brian Shank.
Good evening, everybody. Kind of sit up here, so I'm not sitting behind anybody. A few things tonight. As far as my report goes, I just wanted to point out, we are having some challenges that we're working through with custody staffing, as I noted. COVID's made it very difficult with the isolations and quarantines that we've had. We're currently down 8 positions today due to COVID isolations. We've also got another 5 members out on medical leave that's unrelated to the job, and 2 that were injured on the job. So that, coupled with 9 vacant positions that we're working to fill, it's been very challenging. We're down 25% of our staff in the jail. However, I will commend the staff that is there. They've all been doing a great job signing up voluntarily for overtime to cover our mandatory posts. So we've been able to maintain those. We do still have 20, as of today, 26 federal board-ins. I was concerned that if we got too low on staff, that we could potentially have to close down an area and push some of them out, but we've been able to maintain those to stay on track to what we budgeted for revenue. But recruiting, I think, moving forward is going to be a challenge for not just the jail, but also the road. Knock on wood, we're doing okay on the road. We just hired a new member. Depending on how the resolutions go here, we may be looking to hire another member or 2 for backfills for a February academy. But moving forward, I think staffing is going to be something that's going to be a challenge moving forward, recruiting and getting qualified candidates to seek out these positions. I know that we're not alone in that. I meet with a number of local sheriffs periodically, and once a week we're on a statewide call with the New York State Sheriff's Association. This is something that's going on across the board, so it's not unique to our county. I wanted to make you aware, Dr. Durant will likely talk about this at your legislative meeting, the full meeting, but CCC is exploring a potential program to offer a police academy at the college. It will likely, if it moves forward, be at the Fulton campus. It would allow Oswego County and Cayuga County to potentially partner to have a local academy that we could utilize here close to home. One that we could utilize for recruiting because they would offer some degree programs that would go along with paid academies. If somebody wanted to put themselves through a phase 1 academy, they could pay to do that and make themselves more marketable by obtaining that degree and then being able to apply to different law enforcement agencies. So I was involved with a couple of conversations with some agencies in Oswego, with the college, and some members that are already offering an academy. The Oswego County Sheriff's Office and Oswego City PD already offer an academy once a year, but they're looking to partner with the college and possibly us to expand that. That may be something that could potentially help us with recruiting in the future if we continue to struggle with that, if it's not something that changes. But Dr. Durant, I'm sure will give some additional information on that. It's in the early planning phases just to see if it would be feasible and if it would be something that would be marketable. So I wanted to mention that. Before I get to my resolutions and I talked to Mr. Chair in regards to the mobile crisis, I want to talk quickly about that. In my report, I did note that we were awarded the $66,000 grant if we move forward with the body worn camera program. So I know a number of you were here last year when our members and I gave a presentation about body worn cameras, why we thought they would be beneficial to our sheriff's office to have those. The legislature last year asked that I not work to budget that I bring that back this year if we were awarded that grant, which we were. So I'm not sure how the body would like us to move forward, if you'd like us or be willing to allow us to present again to the legislators that were not here before, or if you want to discuss that without the presentation. But I certainly support that program. I think it would be positive for us to move in that direction. You may have seen the article in the Citizen last Sunday. The state police are already moving forward with those, and the Auburn Police Department's moving forward with it as well. It sounds like the Auburn Police Department is allocating some of their ARPA funding to do that. But I believe there's a lot of benefits to having body worn cameras. I think they not only provide transparency, but they also protect our members, and that we have a full video accounting of what happened with every incident. And it's the best evidence when it comes to what actually happened out there in the field. But everybody today, as I said in our presentation, has a camera in their pocket on their cell phone, and they can take a little snippet and provide you what little bit they want you to see. And that can be something that would potentially be put our members in a bad spot. If there's more to the story than what we're given by somebody with their cell phone, right? I would much rather see us have the full video of what happened with those incidents. So I advocate for those, and hopefully we can move forward.
Question or comments, Mr. Peters?
So, just for clarification, you received $60,000 for the implementation of the body camera. You have 60 to go.
$66,000 was awarded to us if we move forward with it.
66. Do you know? Well, let's not do that. So I think, the best way to go about this would be for you to, as you said, present to us with the total cost of the implementation, what the total ask would be of the ARPA funds, and say February's.
We could do that. We could update the numbers of what we had in the fall if they need to be updated, and come back and explain why we feel they would be beneficial to us if the legislature was willing to allow us to do that.
So ARPA has to be spent by 2025. When does this 60,000 have to be spent by?
I believe we have 2 months to do that.
2 months to spend that 60.
It has to be all spent by then?
No, well, we have to commit to it, not to spend it, but
Accept it, but
accept it within 2 months.
Okay, all right, so definitely February.
Yeah.
Okay, thank you.
With as many new legislators, we should present.
yeah.
In
It did include, I thought, startup, the camera costs, there was a staff, a clerk or something that was, I mean, you had a whole proposal and that's what you're recommending. He come back with the proposal and what the ARPA fund ask would be and how long it would cover.
I would recommend that for those legislators that didn't see the presentation, that we be allowed to do that so you can understand why we would be proposing adding a clerk position and why they would be beneficial for us to do that.
Because we would have to commit by March.
We have 2 months to accept the.
Right, just to make sure. So if we run it by February JPS, it's sufficient time to
Bring in
accept.
front of health or ways and means and in front of full ledger.
Because Chris, you're saying if the county isn't going to commit to the proposal of the ARPA funds, why would he take 66,000 to, right, that, I mean, you really need a commitment from,
Has to be done next
Right.
month.
We
Yeah.
do, we have to have budgetary, a
Right.
budgetary commitment from the legislature before we can accept that and move forward. And it is not budgeted, so.
I think that's a fair plan.
So we'll present again to the February judicial public safety.
Alrighty, any other questions or comments before we get into resolution?
I'll just make a comment. I mean, this is a perfect example of why it's hard for us to look at ARPA comprehensively all at once, because these opportunities are rolling and they're going to continue to roll as the new grant programs come out and opportunities come up to match and leverage. So I think we do need to address it now and look at that ARPA request as it stands, without having to wait for all of the other, full body of projects. It'd be great to be able to see everything all at once, but in reality, it doesn't play out that way.
Ms. Daly?
I absolutely see what you're saying. I hope, we have to take opportunities when they come. And I hope we can, sooner than later, just come up as a body and decide what are the big projects that we all could get on board with. That would be great. And then kind of cost that out and see what we're left with.
Ms. Nightingale, go ahead.
Sheriff, I just wondered, how do you compare the 441 responses so far to the community survey to last year's survey? Are we down, up?
We're down just a little bit. I did check today and we had 463 responses, so we're up just a little bit, but I believe that we were 550 or so last year from my memory. So we're down just a little bit. It's still a pretty decent number.
Yeah.
And I'll have some information relative to that in the future meeting.
Any other comments? Questions? Okay, resolutions. I am looking at JP4 and JP7, move them as a bundle. Anybody? I have a motion. Can I get a second on JP4 and 7? Motion by Mr. Petrus, seconded by Andy. Discussion.
4 and 7.
4 and 7.
Just 4 and 7. Okay.
Because they're
They're
connected, what we've been
connected.
talking about.
Yeah, they're connected.
I'm assuming they're budget.
They are.
Oh,
I guess I just have a question on 4 in terms of going from having a supervisor position to not having a supervisor position. I assume that meets your requirements, but I was just wondering if you could comment on that a little bit.
Sure. So we've only had 2 corporal positions that we've utilized to perform supervisory duties as well as patrol duties when there's no supervision needed for that particular shift. If there's a sergeant on that shift, as well as the corporal is just going to be out there answering calls for service and not actually performing a supervisory function. We've only had 2 on our manning documents, and we converted 1 corporal position a while back to an identification officer position, and we just don't need that corporal position anymore. So I don't see the need to have that, and since it's vacant, I think it's a good time to abolish that and just make it a patrol position. be a cost savings, I think, of about $3,500.
It's rarely we downgrade a job, right?
And I just, we don't need it, so I don't, it's not necessary to have it, so.
Any other discussions on bundling JP4 and JP7? Got a motion in a second. All in favor?
Aye.
Any opposed? Carried. JP5. Sheriff, would you like?
Sure, so this is a resolution authorizing us to extend the contract we have currently with East Hill to provide LPNs to the jail to assist us with our nursing needs. As the legislators that were here last year know, we had some challenges with nursing staff. We've recently filled our third registered nursing position. She's training. It's going to be a little while before she's up and going on her own, but the LPNs that we're utilizing from East Hill are passing medications within our facility part-time. And what that allows us to have our registered nurses focus on actual nursing functions that they can do that LPNs can't, rather than tie up their time passing meds. So we did put some additional money in our budget this year to pay the LPNs part-time to pass the meds so that we can free up the other nurses and hopefully limit some overtime. I think that we're going to be able to limit overtime that our RNs are going to have to work to provide coverage. So we did contract with East Hill because they have the LPNs. They've committed to us to allow the LPNs to come at the off hours that we need them for short periods of time, where I think it would be very difficult to hire them on our own without East Hill's help. And we do actually employ them. Rich tried to work with East Hill to figure out a way that we could make this work with just paying them per diem, or however that might work with East Hill. But in order for the county to accept the liability for their work, we had to hire them part-time. So they're actually working for us part-time, but East Hill is making sure that we have them available when we need them. And that is what this resolution covers, to extend our contract for the referrals so that we can keep them.
Move it.
You have a motion? Second. Second by Mr. Petcher.
Rich, the resolution does say employed by East Hill, but that's not a big deal, right?
Any other discussions on JP5? All in favor?
Aye.
Opposed? Carried. JP6.
JP6, during the budget process, I shifted some funding from the jail. I took the funding from one custody officer position and shifted onto the road patrol side in hopes that I could create and fill this identification officer position. This position would be used primarily to address the sharp increase we've had in pistol permit applications, new applications, pistol permit amendments, and the sharp increase we've had in the need to do background investigations. With the turnover that we've had a significant increase in the number of employment background investigations that we have to do. In 2018, just to give you an idea, we had 25 backgrounds that we actually started and completed. In 2021, we've actually initiated 60 background investigations. With the turnover that we've had over the last few years. It's just been a very, very sharp increase in the number of people moving on for other positions. Not just people that have their time to retire, but people that just decide they're going to look elsewhere to go to work. There's with the market out there, the employment market, that people are able to to find jobs making a lot more money, and some have left before they have their actual retirement time in. But I ran some figures to look at the turnover rates we've had, and going back to 2009, we had turnover, we lost 3 people. 2021, we lost 18. So and it's just gradually increased from 2009 on. So we have had a significant increase in the number of background investigations that we're doing. And we've had our members in CID and the Criminal Investigations Division just continually doing background investigations. And I can't have them doing that. They've got to be working on criminal cases and not devoted to that type of thing. So I looked to shift the funding from the jail to the road to not look, I didn't want to ask for funding to actually create a new additional position. I shifted that funding, to try to, be responsible here, but I'm looking to create this position to do the backgrounds and work on a significant increase we've had in new applications for pistol permits.
Move it.
I have a motion on the floor for JP six, seconded by Mr. Petrus. Can I get any discussion or question?
Yeah, I have just a quick question. Since when do you guys not have an ID officer?
We have one IDO officer currently that's doing pistol permit amendments and handling all of our evidence.
All right, so this is an additional ID officer.
And this would be an additional one to pick up the increase in work that we've had there and to do the background investigations. I've actually had one of our road patrol deputies has been in there doing this work off and on for the last few months. But it's taken a car off the road, and we just don't have the staffing to take people off the road. So we need to create that additional position to keep that deputy on the road.
Any other comments on JP six? I have
Just a
a,
question.
go ahead. Okay.
For the pistol permit applications, what is the response time now in processing those?
It's been a lot longer than normal due to COVID. There was a long period of time where county court was not signing pistol permit applications, signing off on them. When COVID first hit, we just started to see a buildup of those, and we just had a big backlog, but we've just recently in-house caught up on those, and we've got quite a few at county court currently. So Judge Leon's working diligently to try to catch up on those, but our goal is to have that down to about 3 or 4 months total from start to finish. It did get to a period of time when it was pushing, 8 months, and that's just too long. But part of that had to do with the fact that the county court wasn't addressing them, and we just got behind on them.
Any other questions, concerns? I have a motion and a second. All in favor?
Aye.
Opposed? Carried. JP8, sir.
JPA is looking for authorization to fill our seasonal positions for the Marine Patrol Unit. This resolution is coming a month or two earlier than we normally do that, but I wanted to make sure that we had time to recruit, because just like every position we're recruiting for, it's taking more work to get candidates to fill these jobs. So I want to make sure we've got time to recruit before we need to fill these positions at the end of May, a little bit of time to train them. And I also asked for a $2 an hour increase for these positions that we do have funding in the budget for. But my primary goal with this is right now, when we put the boats out the last couple of years, we've had to put 2 road patrol deputies out, usually on overtime, if we have to get them out on the water. If we can fill these civilian staff positions at $18 an hour, then we can put more civilians out there partnering with 1 deputy, and we can eliminate 1 deputy on the boat working overtime. So if we can fill these positions, we'll actually see an overtime cost savings when we have to put the boats out there. But it's been very difficult the last few years to recruit part-time police officers from other agencies. They're just not interested in these positions. And, if we can get the civilian boat hands out there to partner with an actual deputy, it'll save us some money, save us some overtime money.
Move it.
I have a motion on the floor for JP8. Can I get a second? Seconded by Mr. Shea. Discussion?
Just a crazy question. Do you have to swim or do you have the skill set?
I had a
It's preferred.
I had a crazier question than that. The sheriff already knows what it is. That's Jim.
Excuse me, can I get a different second on that? Because Mr. Shea is not on the committee.
I'm sorry.
I'll second it, Elaine. Can't say it.
Thank you.
My zeal took over.
Okay, now that we have a legal second, any other discussion? Can I get a?
Yes.
Yes.
They do have to swim is the answer, I guess,
That's
yes.
preferred.
Can I get a vote? All in favor?
Aye.
Opposed? Carried. JP9, sir.
JP9, our final resolution is to replace 1 marked patrol car that was struck by a drunk driver while it was parked at our deputy's home. So insurance did pay for the vehicle. As you'll see in the resolution, the insurance didn't cover the whole cost, but we obviously need to replace that vehicle. Oh, JP, stay
have a motion. Can I get a second?
Not yet.
Second by Ms. Nightingale, all discussion.
I was just, and I'll ask it Ways and Means, I was curious why we take it out of fund balance when we could move it from casualty and liability, but it's not a big deal. Lynn advised him to do it this way, and if so, we'll have to put 2/3 on this, right? That comes from fund balance.
Like it's the full.
Right. I just was curious why we would do it that way.
Right.
That was my question too. I was
Right.
thinking contingency.
Yeah, contingency, the casualty liability line, right, fund balance, but we can talk more about that, Hans, at Ways and Means.
That was Lynn's recommendation.
Yeah.
Say Lynn needs to have her-
I can't explain why.
She might, that's what he said. Lynn will be there. She might have a reason. I'm not quite either.
We have a motion and a second. All in favor?
Aye.
Carried. Any other business come before this committee?
Mobile crisis, just a few minutes on that. Thanks for bearing with me.
Yes, yes, sir.
Monday night, if you were here for Health and Human Services, Mental Health Director, or DCS, spoke a little bit about mobile crisis, looking to expand that. A little while back, Chief Slayton with the Auburn Police Department, the city of Auburn, and Chairman Gould's met with us too, but they approached me about their interest in trying to come together, the city and the county, in expanding mobile crisis for mental health crisis incidents. If you're not familiar with mobile crisis, our county contracts with Liberty Resources to provide clinicians and mental health professionals that are able to respond to incidents when someone's in a mental health crisis. Right now, it's just really available to law enforcement to call them to come deal with the crisis. And the whole goal is that these folks come, they bring a mental health response to a mental health incident. They keep our law enforcement people out on the road and not tied up at the hospital with these folks, because often we don't have the tools to address these incidents. So we have to take them to the hospital. We get tied up there for a few hours. It can often tie up a couple of cars, but right now it's only available to us from 5 p.m. until midnight, and on weekends from 6 a.m. until midnight. The goal is we're looking to try to expand this so it's available to law enforcement after midnight. And the mental health director actually has a plan that I think he spoke about Monday night to make some service available during the day to answer these types of calls. By bringing on some additional staffing at mental health that as we move forward would actually be able to bill for some of this work. So there would be some startup money. I can't talk to the actual cost. That would be more for the DCS and their mental health director to speak to. And I think he spoke about that the other night, but I'm just here to let you know that as a service related to our law enforcement efforts, it's a very positive thing to keep our cars on the road. We have a very limited number of cars on the road. As far as the sheriff's office is concerned, tonight we have 3 cars on and 1 supervisor. So we get tied up with that type of call. It really ties our hands, and we'll wind up with one or 2 cars on the road. So I would like to advocate that we, really take a hard look at this. I think it's good for the people that need the service. They have nowhere else to turn. They're calling 911 for help. And the law enforcement members that we have just are not equipped to deal with these incidents. So I think there's a lot of benefits to this. I think by addressing these incidents with a mental health response, we can keep a lot of these folks from committing offenses that could land them in jail. We have a lot of people sitting in jail that are just, struggling with mental health issues that wind up committing a crime or something, and they're there and we're addressing it. So I think we can really work on some things that will be very beneficial to us to keep our cars on the road and help these folks.
Yeah, but I don't want to, if anybody else has anything before I.
Mr. Chairman, if I may.
Yes, sir.
Sorry for the additional moment, but as I was listening to Sheriff Skank talking about how busy they were, I realized I was remiss in letting everyone here know that when EMO is under a real time crunch, and as you know, we're a very, very small department, but we're under time crunch to get deliveries of the masks out to all the towns the sheriff was very kind and his staff was made available to assist us with those deliveries. So they were a great partner, and I wanted folks to know that they're stretching out in many ways people probably don't realize. So thank you, Brian.
Thank you.
Yeah, so just my concern, if, and I don't have my notes in front of me, sitting on my table where I was during the meeting. But I think I think we really gotta look at this in terms of, because I think as proposed, Ray proposed taking some ARPA money to kind of get this rolling. Am I correct in that? And then when not only would we use the ARPA money in and of itself, which isn't that bad, but then there is, if indeed it does happen, there will be positions that are created and will have to be funded in perpetuity. So I think, like you said, I think your words are best. We need to take a good hard look at it, because we would be indeed, as I understand it, creating new positions, and it's for a program which may be extremely effective. But I think it's fair to say that we haven't tested its efficacy at this point.
If I may, right now it's available to us, as I said, the hours between 5 and midnight on weeknights, and on weekends from 6 a.m. to midnight. It's extremely effective during those timeframes that we're able to utilize that service. I think through October, we used it 31 times, and the Auburn Police Department used it 49, but I'm actually seeing that start to increase as more of our people get familiar with it and comfortable with the service. But, you know, it's that many times that we were able to avoid sitting at the hospital, that we, you know, a lot of these incidents, when we show up in a uniform, we escalate the situation. It's really a mental health crisis situation that the police are showing up to in uniform and escalating it. So I know that one of the goals of this expansion too would be to open it up so individuals can call directly without having to go through law enforcement, so that we wouldn't even have to respond, which I think is a great thing. You know, if police don't have to respond and potentially get in an altercation with somebody over a mental health situation, that's good for the person and good for us. You know, we're using our resources in the way that we should be utilizing them. And again, I can't speak to what the numbers could potentially look like, but there are some opportunities to bill Medicaid for these services, you know, if we're able to actually put them in place.
It shouldn't. I mean, I'm assuming right now an officer goes to start with, and when you're not needed, they leave. Seems a little, I guess I'm a little leery of, you don't know what the mental health people are getting into when they get there. If they're called, no, this is a mental health issue. Okay, you're going by what somebody told you on the phone, but you don't know how crazy somebody can, I mean.
There would be a triage situation where they may still have to have law enforcement respond. I can't say in every incident it would be appropriate for you know, the mobile crisis counselors to go respond to that, but it would take a lot of work off our plate. But there would be times when they're not going to feel comfortable going to address that. They're going to take us with them. But what happens is generally they know how to address these situations and set somebody up with the services they need and keep us from having to take them to the hospital and wait for that assessment.
Yeah, that's what I was getting at. The initial being there to make sure it's what it's all said it's going to be, and then.
Right. There's some interesting things going on across the state. In Broome County, their 911 center, actually, the dispatchers will actually take the call and receive some specialized training. And Denise and I have talked about this, that it may be something way down the road that we could look at, but the dispatchers there will actually triage these situations and they'll deploy the particular resources. They might just deploy, you know, a mobile crisis team rather than law enforcement. It really works well down there for them.
Just like, yeah.
So Sheriff, what we want to look at or think about down the road then is not necessarily that we would increase our staff as a county, but that we would increase our contracting with Liberty Resources.
You were at Health and Human Services.
Right, yep.
And the proposal that I thought the pitch was to bring to Ways and Means was to identify $200,000 to expand the contract with Liberty Resources so they could continue what they're doing from 5 at night till midnight and then go through till the morning. The other 85 or 90,000 of that proposal, because it would be about a $300,000 ARPA ask, is the daytime coverage, which is the part that would, you could fund part of it, you could fund all of it, which would be the addition of 2 staff in mental health and an adult protective and a child protective worker that could be mobilized during the day to go out and respond to these things as well. So you increase the complement during the day and then but that's where the, I guess, 300,000 would come from. He did say that therapist level staff, if they have a crisis rate, so if they intervene on scene and it's under crisis,
That's
there's
just-
some billing, but I don't know if it would be
Yeah, that-
certainly covered the whole cost of this.
And there's billing,
Well, that's the
if you said
thing.
2 or 3 sessions after, it still stays within that.
Maybe, yes, yeah, that's the detail I don't know. He just brought that forward.
That's
That's
all I
still
was
a lot
gonna,
of
that's all I was gonna
cases.
add to the conversation. Is that this very well may be an extremely effective resource. However, I want everyone to know that this sort of modality or idea that it is gonna become a Medicaid billable, self-reliant program in the future is highly speculative. And,
Yes,
you know,
that's true.
I just want everybody to know that we could be at the end of this on the hook for $200,000-300,000 a year.
Sure, because what
Potentially,
happens,
you know.
like what happens in terms of billing in a situation where I call? I'm not Medicaid. So how does the county get reimbursed if it's someone calling because I'm having a crisis and it's, you know,
I
How does
can't
that
answer that.
Currently, Liberty Resources has a dollar amount, and if they bill Medicaid, they reduce that amount, but the balance is based on the contract with the county, right?
I think it would all depend on the qualifications, and please, someone, you guys probably know better than me. It would be, depend on the qualifications of the person responding. So to say, if it's a mental health, like a MSW or something, you could probably bill at that rate, or if it's a, I don't know, someone with a bachelor's level, again, you know better than me. What, I think that would determine what the billing is gonna look like and who they send out. So again, a lot of questions, I would think.
Based on what I've seen over the last few years, having it available for the limited time that we do, I think would be very, very beneficial. And again, I can't speak to the billing. That's not, you know, my area of expertise, but it sounds like there is some billing opportunities here to offset some of this. But the biggest benefit that I see of this is keeping our law enforcement people doing law enforcement work, not mental health work, because we've really been strapped with doing a lot in that arena that we're not qualified to do. And, you know, I want to keep our cars on the road, you know, being proactive, doing what they should be doing, not sitting at the hospital. And again, another benefit is we're not clogging up our emergency room with these calls too. If they can deal with those issues and provide them the assistance they need, they're not sitting at the ER tying up those resources as well. So, you know, I really think this would be beneficial. I can tell you that the city of Auburn is really eager to try to do something this right away. They deal with a lot of these types of calls. They've seen the benefit in mobile crisis coming out, responding to these scenes, and they are very eager to try to do something and move this forward, partnering with us. So
That would be great.
the city really wants to do something.
Mr. Chairman, this is Jay DeWispel here. Could I comment?
If you'll hang on just a second, Jay, the chairman of the legislature has a comment.
Yeah, I'm 100% behind you, you know that, right, with that whole program. I think a good idea is to invite Ray back to Lays and have him explain a little bit more what this funding is like and how he's going to, or his person taking over for him is going to get this money.
Even a budget, like.
Yeah, or some sort of budget, just invite Ray back, because Brian's not the budget person, Ray is. So that's just my opinion.
Brian, would you be willing to come to the meeting also?
Oh, sure. I'll be at Ways, and yeah, I'll be there.
Okay, Jay, go ahead.
Thank you. Just as a way of supporting the sheriff and giving some additional information, in perhaps an unanticipated way. if there's intervention early in a mental health crisis that can keep an individual out of the criminal justice system, I really believe that's a positive for the county to look at. Over the last 10 to 15 years, an increasing number of these types of individuals are ending up on our caseloads because by the time law enforcement arrives, or as the sheriff has alluded to, that can be an escalating effect. Individuals are now charged with assault, resisting arrest, criminal mischief, destruction of property, and they wind up then coming through, and because of an attendant lack of mental health services in some cases, now they're on probation caseloads, and we're not trained to deal with them either. So we continue to feed them back into the criminal justice system, where they then wind up back in the sheriff's custody in the jail. So if there's an ability to look at a system that would keep individuals in mental crisis from entering the criminal justice system, it's going to pay off for the county in a variety of ways, because they're not going to get arrested, they're not tying up road patrol deputies, they're not getting sentenced to probation, and then we're not turning them back through the court system and tying up judges and attorneys for dealing with what at one point in time was a mental health issue. So just from the probation perspective, that's how mental health in the criminal justice system impacts us. And I would like to support what the sheriff is speaking to.
Thank you, Jay.
And just so I just want to make sure everybody's clear, and this is really something Ray can explain better at Ways and Means if he's willing to come or able, but he had proposed, because we had looked at contract pricing that he can speak to from Liberty Resources to provide the full service for 24/7 coverage. But Ray believed by looking at his staffing and what could potentially be billable, that it would actually be more cost effective to do it during the daytime, utilizing his own people. And I think that his plan was that if he puts that team together, he can also utilize them in our local schools to deal with a lot of crisis situations that we're starting to see in schools. I mean, I think everybody knows, the strain that this has put on the COVID's put on a lot of our kids with, not having that structure in school. I believe they're seeing a lot of additional mental health challenges within the schools, but utilizing this daytime staff for this coverage would also benefit issues that are going on in school. But he can speak to the cost effectiveness of doing it through the clinic rather than
when they're not on the road, they could be integrated into the service and delivery system in the clinic or back with the county. That's what I think the point.
That was his plan.
Mr. Feeney, go ahead.
Thank you. Thank you, Sheriff, for this information. Do you happen to know why it was originally implemented as a part-time program?
I think it had to do with available funding, but Ray would have to speak to that.
Yes.
There was some funding made available for this program via the state, I believe. And again, Ray would have to speak to
His
that.
regional directors group, that was that money Lydia he was talking about, that they broker 700,000, it goes to various counties and they use it for mobile crisis. But the expansion of it was always seen as too expensive.
But I think seeing the benefits of how we've utilized it have made it, become a priority to try to do this and expand it.
Thank you.
Thank you.
Any other comments or concerns? Sheriff, thank you for your time, sir.
Thank you all very much.
Motion to adjourn.
Okay, thank you everyone for attending.
Oh, man, I'm sorry. Man.